Chapter 2. GLUT1DS is like this. At the city gate, half the delivery trucks are gone. Sometimes blood glucose is normal, but the brain is still starving. This condition is called GLUT1 Deficiency Syndrome, GLUT1DS. Here's the simplest way to think about it. It's not that you eat too little, it's that the brain can't get the sugar in. GLUT1DS is a genetic metabolic disorder. It falls under conditions tied to energy supply. Most cases involve one key gene, SLC2A1. That gene makes a transporter. Its job is straightforward: move glucose from the blood into the brain. So why doesn't glucose get in? Because between blood and brain, there's a checkpoint. It's called the blood-brain barrier. Don't let the name scare you. Think of it as the city gate, and GLUT1 is one of the main passes that lets glucose through that gate. When that pass doesn't work, you get a classic pattern: there's sugar in the blood. But the brain is still short on fuel. Case 1. Why is low CSF glucose such a key landmark? Let's use the city analogy. The brain is a city that never shuts down. It needs constant power to keep neurons firing, to keep connections working, and to support development. The carbs we eat eventually become glucose. Glucose is the city's main fuel, and GLUT1 is like the permit that lets fuel trucks enter the city. When permits are limited, a strange thing happens. Blood glucose can look fine, but the brain is still hungry. That's why low CSF glucose matters. CSF, cerebrospinal fluid, is one of the closest windows we have into the brain's fuel supply. Low CSF glucose can look like this. The warehouse inside the city is empty, even though the highway outside has traffic. Sometimes CSF lactate is low, or low normal as well. That points away from low oxygen fermentation, and it points towards something else. The fuel isn't getting in. A practical note: once the acute emergency is excluded and the patient is stable, CSF interpretation is best when you also check a paired blood glucose at the same time. So you can calculate the CSF to blood glucose ratio. That ratio helps keep the interpretation from drifting in the wrong direction. Case 2. Why do symptoms look neurological and sometimes